Schizotypal personality disorder represents one of the most complex and enigmatic conditions within the spectrum of personality disorders, affecting approximately 3 to 5% of the general population. This fascinating yet challenging disorder is characterized by a pervasive pattern of social and interpersonal deficits marked by acute discomfort with close relationships, cognitive or perceptual distortions, and eccentric behavior that begins by early adulthood and presents across various contexts. Unlike other personality disorders that primarily affect emotional regulation or interpersonal functioning, schizotypal personality disorder uniquely combines social difficulties with unusual thinking patterns and perceptual experiences that can appear almost psychotic in nature, yet remain within the bounds of personality pathology rather than crossing into full psychotic disorders. The diagnostic criteria for schizotypal personality disorder require the presence of at least 5 specific symptoms from a comprehensive list that encompasses both cognitive perceptual oddities and interpersonal difficulties. These symptoms include ideas of reference, which involve incorrectly interpreting casual incidents and external events as having particular and unusual meanings specifically for the individual, odd beliefs or magical thinking that influences behavior and is inconsistent with subcultural norms, unusual perceptual experiences, including bodily illusions, odd thinking and speech patterns that may appear vague, circumstantial, metaphorical, over-elaborated or stereotyped, suspiciousness or paranoid, ideation, inappropriate or constricted emotional responses, behavior or appearance that is odd, eccentric, or peculiar, lack of close friends or confidants other than immediate family members, and excessive social anxiety that does not diminish with familiarity and tends to be associated with paranoid fears rather than negative judgments about oneself. The development of schizotypal personality disorder appears to emerge from a complex interplay of genetic vulnerability, neurobiological factors, and environmental influences. Research consistently demonstrates strong genetic connections between schizotypal personality disorder and schizophrenia, with individuals having first-degree relatives with schizophrenia showing significantly higher rates of developing schizotypal traits. This genetic relationship has led some researchers to conceptualize schizotypal personality disorder as part of the broader schizophrenia spectrum, representing a milder but related condition that shares similar underlying biological vulnerabilities. Neuroimaging studies have revealed structural and functional brain differences in individuals with schizotypal personality disorder, particularly in areas associated with social cognition, executive functioning, and sensory processing. Environmental factors also play crucial roles in the development of schizotypal personality disorder. Childhood trauma, particularly emotional abuse and neglect, has been strongly associated with the development of schizotypal traits in adulthood. Early experiences of social rejection, family dysfunction, or exposure to chaotic or unpredictable environments may contribute to the development of the social withdrawal and paranoid thinking characteristic of this disorder. Some studies suggest that individuals who develop schizotypal personality disorder may have experienced early disruptions in attachment relationships or grown up in families with high levels of criticism, hostility, or emotional instability. Living with schizotypal personality disorder creates profound challenges across multiple domains of functioning. The combination of social anxiety, paranoid thinking, and eccentric behavior often leads to significant social isolation and difficulty maintaining relationships. Individuals with this disorder frequently experience chronic loneliness and may desperately want social connections while simultaneously fearing them. Their odd behavior and unusual thinking patterns can make others uncomfortable, leading to rejection and reinforcing their beliefs about being different or misunderstood. The magical thinking and perceptual distortions associated with the disorder can interfere with practical decision-making and daily functioning, sometimes leading to poor judgment or inappropriate responses to situations. Academic and occupational functioning is often impaired in individuals with schizotypal personality disorder. Their difficulties with concentration, odd communication patterns, and social anxiety can interfere with educational achievement and job performance. While some individuals may find success in creative or unconventional fields where their unique perspectives are valued, many struggle with traditional work environments that require consistent social interaction and adherence to conventional norms. The cognitive difficulties associated with the disorder, including problems with attention, memory, and executive functioning, can further complicate academic and professional success. The impact on family relationships can be particularly challenging, as family members may struggle to understand their loved one's unusual behaviors and thinking patterns. Parents may worry about their child's social isolation and eccentric behavior, while siblings and partners may feel frustrated by the individual's apparent indifference to social conventions and difficulty forming close emotional bonds. The paranoid ideation characteristic of the disorder can create additional strain in relationships, as individuals may misinterpret family members' actions or words as threatening or malicious. Diagnosing schizotypal personality disorder requires careful assessment by experienced mental health professionals, as the symptoms can overlap with other conditions including autism spectrum disorders, social anxiety disorder, avoidant personality disorder, and early stages of psychotic disorders. The diagnostic process involves comprehensive clinical interviews, psychological assessments, and careful observation of the individual's behavior patterns and thinking processes over time. Clinicians must differentiate between the mild perceptual distortions and odd beliefs characteristic of schizotypal personality disorder and the more severe delusions and hallucinations associated with psychotic disorders. Treatment of schizotypal personality disorder typically involves a multimodal approach combining psychotherapy, social skills training, and sometimes medication to address specific symptoms. Cognitive behavioral therapy can help individuals challenge odd beliefs and develop more adaptive thinking patterns, while also addressing social anxiety and improving interpersonal skills. Social skills training is particularly valuable as it provides structured opportunities to practice appropriate social behaviors and communication techniques in a supportive environment. Group therapy can be beneficial for some individuals, though it must be carefully structured to account for their social anxiety and tendency toward paranoid thinking. Psychodynamic therapy may help individuals explore underlying emotional conflicts and childhood experiences that contribute to their symptoms, while family therapy can provide support and education for family members struggling to understand and cope with their loved one's condition. Medication is not typically prescribed specifically for schizotypal personality disorder, but may be used to address co-occurring symptoms such as depression, anxiety, or mild psychotic symptoms. Low-dose antipsychotic medications may sometimes be helpful for individuals experiencing significant perceptual distortions or paranoid ideation. The prognosis for schizotypal personality disorder varies considerably among individuals. Some people may experience gradual improvement in their social functioning and reduction in odd behaviors over time, particularly with consistent treatment and support. However, the chronic nature of personality disorders means that complete remission is uncommon, and many individuals will continue to experience some degree of social difficulties and eccentric thinking throughout their lives. Early intervention and comprehensive treatment can significantly improve outcomes and quality of life. Research into schizotypal personality disorder continues to advance our understanding of its neurobiological foundations and relationship to other psychiatric conditions. Studies investigating genetic factors, brain structure and function, and environmental influences are providing valuable insights that may lead to more effective treatments in the future. Prevention efforts focus on early identification and intervention, particularly in children and adolescents showing early signs of social withdrawal, odd thinking, or perceptual disturbances.